So it's almost like, and it's a shame, I worked hard to get my credentials, but it's almost like when I hear somebody that's about to speak and they're a registered dietitian, the chances are that they have that old school convoluted protocol, and it's shameful to me because I almost don't want to tell people that I'm a registered dietitian anymore, because I know that 95% of them are bullshit. They don't get it, and they don't want to, because in their world they can have sugar. Sugar is healthy. It's not, but everything in moderation.
And that's the main campaign statement for Eat Right, right? Everything in moderation.
Exactly.
Yeah, so the way I see it, it's like the MyPlate is just a rebranding of the food pyramid.
Yes.
I think the food pyramid is getting a lot of flack these days from a lot of,
Right.
from different sources. So they probably tried to rebrand it into MyPlate. So
Exactly. But it's all the same. It's all the same. They'll tell you that your diet should be predominantly carbohydrates, not low carb, high carb. And and you'd be surprised how many even young people still think that fat is bad. My God,
probably it's yeah.
I mean, that started to fade back in the 90s, before they were even born. But yet, the word fat means fat.
Yeah. So
Yeah,
it's much easier to make that statement that fat makes you fat, because essentially they're same words.
yeah, but it's just, oh my God. And any registered dietitian that tries to, well, not any of them. Some of them are motivated like me, and there are good ones out there. I'm not saying that we all suck, but they're not scientists. Okay, there's great ones out there. I have to say, there's this registered dietitian. Her name's Lily Nichols, and she is an expert on low carb pregnancy for pregnant women. There's Diane Rogers. She's a registered dietitian. She made that documentary, The Sacred Cow. Are you familiar with that? She's brilliant. There are registered dietitians out there that get it. But man, you can, if I sat down and wrote down all their names, I wouldn't be able to fill up all 10 of my fingers. But there's thousands and thousands and thousands of registered dietitians that just toe the line with the old school Ansel Keys food pyramid protocol, and it's not reversing anybody's disease. None of it.
It's the same spectrum with other health professionals like us, physicians, doctors. Probably the same thing, because, well, let's say I cannot blame them. We cannot blame them, because that's what we're taught in
Exactly.
school, in the curriculum.
I get it.
It's a matter of, as you said, it's a matter of unlearning and rethinking all of this ourselves.
Yes.
Yeah, given all the data out there and the facts that we have to sort out.
Yes, be hungry for data. Seek it.
Yeah. So, you being a dietitian, nutritionist, it makes me wonder, especially now that you're openly advocating for what is, for the meantime, not considered the mainstream low carbohydrate. Because for me, low carbohydrate nutrition is coming from the grassroots. It's like me. I'm doing this as an advocacy. I'm coming from the grassroots together with many other. As of now, I have known a couple of, not very many, but a couple of people in the medical profession also, as well as other advocates, also in social media, that are doing our best to come out in the open and spread this message. So, as a nutritionist dietitian yourself, have you ever encountered fierce opposition, whether explicit or implicit, whichever the case may be, from your fellow nutritionists and dietitians, not just there in the US, perhaps, but around the world, perhaps even doctors and other healthcare professionals who are coming up, who are going against your statements
Oh yeah,
because they
constantly.
aren't aware. Yeah.
Well, there's been some controversy in the nutrition news lately for registered dietitians being paid by the food industry, and there was a big, I want to say, a New Yorker article, or maybe it was New York Times. It was New York something Post, perhaps. But anyway, it was a big deal. And there's on social media, both I want to say on Instagram and on Facebook, they call themselves build up dietitians, and it's like a page for dietitians, and the admins that post in that group, they search the internet for stuff that they think is bad, and they find my stuff and they put it in their little group, and all the dogmatic dietitians just sit there and talk about, oh, they're not getting any energy to their brain, and whatever. It depends on what the topic is, but every once in a while they'll take one of my graphics that I've made and that I've spread. Like when I post something, it gets shared 200 times. I'm not talking about 200 likes. I'm talking about it's shared 200 times. So it gets to them, and I don't even respond. I just look and laugh, because why am I going to spend my time arguing with these people when I can back up my arguments with studies that are peer reviewed and published in medical journals, and they can't back their argument up with anything other than the 1990s brand textbooks that they learned in college. And they've got their own opinions, but they can't really back them up. I mean, there's doctors out there that are vegans and whatever, but they're just talking. They don't, you every once in a while you hear somebody say, oh, well, I reversed my diabetes with a vegan diet. And I'm like, okay, that sounds just biologically impossible to me, because I understand the biology behind what we do with our low carb treatments. How is it possible that the exact opposite will also work? That doesn't make any sense to me. You know what I mean? It's like, okay, so you don't have insulin and it doesn't work the way mine does? Is that what you're saying? Because, it's just, I, if I argued with everyone who opposed my position on things, it would consume my day. And years and years ago, I used to try to argue, but now I have so many people coming in that if they are there to learn, I will teach them. But if they're just there to call me stupid and argue with me, I'll delete them so fast and make their head spin, and I will never see that face again in my social media world. You know what I mean? Because you can tell when somebody wants to learn, as opposed to when somebody just wants to argue and cause trouble and try to make you feel stupid or whatever. It's too easy to just move on because, like I said, I'm the sole admin of several big platforms. I don't have time to argue with vegans. I'm not going to change their mind because you think I was teasing you that I sound like a preacher. They do that too, you know. And when you can tell that they are already just so far sold on that vegan idea, there's no point in arguing with them because they they've got their antiquated rebuttals to anything that I'm going to say, and it would just consume my whole day. I would rather just ignore them than try to tackle that. I'm there to educate people, not to argue with people. There's a difference.
You're saying that your statements, your arguments are backed up with peer-reviewed journals and research. The main problem, the way I see it, which applies also to my own experience, is the fact that these journal articles and peer-reviewed studies usually do not come up in our conferences.
Right?
In your case, the conferences for dietitians and nutritionists probably because in my case, I'm a physician. I'm a neurologist in my association, the Neurology Association, and even the Association of Internal Medicine Specialists. These studies that we are aware of, like for example, the studies made by Eric Westman, Dr. Eric Westman, for example,
Yes.
Dr. Lustig, Dr. Richard Feynman.
Love
There's a
those are
whole
my
lot of
heroes.
them. Yeah. Well, the problem is when I talk about these studies with my fellow doctors, fellow internists, fellow neurologists, most of them, probably I can only count a handful who have heard of these studies because, admittedly, we have to accept it as a fact that in our conferences, which usually are industry sponsored, they do
Right.
not come out because
Right.
no one will sponsor them.
Right. Right. Right.
So
Well,
probably it's our mission, it's our like part of our advocacy to help people, even other medical practitioners and other dietitians
right.
out there, to be more aware of these studies out of self learning and not just depend on the the studies that are presented in the platforms and the lectures in the conferences that we attend, because if they are industry sponsored, then probably they will mostly be biased.
Yes. Yes. Exactly. Exactly. You're going through you go through the same things I do. We just had ours. They call it FNCE, and I can't remember what it's an acronym. FN FNCE. That's what they call their annual get together of dietitians, and it was in Denver this year. And come, I'd say come about June or July, we start getting emails and to register and to make hotel reservations and all that. Blah, blah, blah. And if you pay, you can register to see it without going. You can see the presentations or whatever. And I've been to one of those, I guess, maybe 3 years ago. And this year, last year, the year before, I wasn't even interested because it just angers me. It just upsets me to see, to walk down, like when you're in an expo hall and you see the protein bars that are really chocolate candy bars, and then just making claims about, food sensitivity tests. And, I just, I was not going to, if they want me to learn their crap, then don't ask me to pay for it because I know that just, it's just a waste of time and nothing good's going to come of it. It's just going to frustrate me. So I don't even go. When I see an email from them that talks about the expo, click, delete. No, it's just, and there's a lot of people that feel the same way. I mean, even in my class, I'd say, and it's sad to say, in my class at Kaiser University, maybe two of the people in my graduating class had a similar attitude to me, and all the rest were just anxious to get their diploma and go and toe the line, do the usual protocols, you know. And it's just sad because unbeknownst to them, and I don't think they do it on purpose, it's what they believe, so that's what they teach. And sometimes, most of the time, it's harmful. And that makes me sad.
It makes me wonder, this thing you're doing with the Unlearn-Rethink platform, it does take a lot of time and effort, right? So, in your case, what drives you? What motivates you to openly advocate about these things, especially low carbohydrate nutrition, in public with your Unlearn-Rethink platform? What's your motivation?
Just to get the word out, and just to, I mean, it really, like, I've never thought of having a motto, but do your own research, and because just because you were told, like, have you ever heard somebody, like, well, they say that you're supposed to do this and they say that you're supposed to do that. Well, who's they? Learn who they is, because sometimes they is wrong. You need to. I just want people to realize that there there is more to than just searching the internet and stopping on the first article that is in a language that that you feel comfortable with. And just because it's got the best search engine optimization, that doesn't make it true. You need to investigate. You need to be thorough and rigorous with your investigations. When it comes to your health, it's more important than your health, or your mom's health, or your child's health. There's nothing more important than that. And I just want to just help make people aware that that there's nothing wrong with looking into things. Just because that person, that general practitioner, is a doctor doesn't mean that they're right about everything, you know. And there's nothing against the doctors, but they're still, well, you need to eat less and exercise more and don't eat fatty foods. And okay, well, right there, it's true all that they said, but that's not helpful, like when you tell someone to eat less and exercise more, that's just like a drowning person saying, swim more and drown less. It's not helpful information. I like to provide just little shareable nuggets that, sometimes, like let's just say the graphic is about fasting, and you were talking to your husband about fasting the other day. He might be interested in this. I'll share it with him. But then you might see my next post, and it's about, you know, uh, uh, like PC, uh, PCOS, which I'm not interested in that, so I don't share that. But I like to just hit all the topics on like a regular basis that apply to different people at different times, so that they'll want to share it. And whenever I can, I like to back it up with a study or an article or an idea, and just broaden people's horizons, because so many people get stuck in the, well, my doctor said this, so that's the way it is. And that's not always, sometimes they're right, but sometimes they're wrong. You want to know for sure. You want to feel comfortable with that treatment or protocol or what have you. I don't know if I'm making any sense.
Yes, you are. For those who listen.
Right, right. I
Yeah,
just,
but
I,
as I said earlier, some people do have bias. So, like let's say the Adventists, perhaps because of religion, they do have certain bias. I think a week or two ago, I was talking to Gary Fetke, and I don't know if you're aware that Gary and his wife Belinda have did their best to do some investigative work. It's like
oh,
investigative
I love it.
journalism
Yeah.
towards the background of all this propaganda, and they figured out that a lot of this, for example, vegetarian propaganda is not actually science based, but
Right.
is like related to medical evangelism. And to cut to the chase, as Gary told me, it's mostly with the Seventh Day Adventists, especially
Yeah.
in terms of the teachings of their prophetess Ellen G. White. And
Yeah.
have you heard of Lenna Cooper? I was
Yes.
asking you about Lenna Cooper before because Lenna Cooper was one of the co-founders of the American Dietetic Association in the early 1900s, and she was I think she was the chief dietitian of the uh, Battle Creek Sanitarium. Have you heard of the Battle Creek
Yes.
Sanitarium in
Yeah.
Michigan? Yeah, which was an institution of the Seventh Day Adventist Church, and in the early 1900s, it was one of the more famous medical institutions that celebrities go to, even
Right.
in past presidents, and that was where Dr. John Harvey Kellogg, heard of him?
Yes. Oh, yeah.
Dr. John Harvey Kellogg was the medical superintendent, and it was Lenna Cooper who he was associated with Dr. Kellogg, and as I told you earlier, Lenna Cooper was the chief dietitian of that institution, and she, along with a couple of others, co-founded the American Dietetic Association, and that's how the 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 position of the dietitians, it was a very big and significant influence in terms of the position of dietitians towards what to to advocate publicly, because the mere fact that Lenna Cooper was an avid Adventist, it was a significant influence towards how the guidelines came to be, especially on the side of the dietitians.
Right.
Uh, yeah.
Right. I try every day. I have like this little formula of the posts on Unlearn-Rethink, and at 2 o'clock every day I post a different. It's just a graphic that highlights a different medical professional or expert with a quote and then a link to their social media or their website or their book or their video lecture or what have you. And whenever the subject of history comes up, Belinda Fetke and Nina Teicholz are the two best. See, they both seem to be the two best sources of for that kind of. It's like investigative reporting. It's like they're like the 60 minutes for food, and I love them. I love them both. And Belinda is brilliant with some of her presentations, and Gary obviously is as well. Um, but I always, maybe 4 times a year, I always feature Belinda and Tina Teicholz, Belinda Fetke, Gary Fetke, obviously, of course. And but there's a lot we can learn from history. It's like when you learn how the origins of something was corrupt, and that you got to always be aware and not just accept um, you know accept the validity of anybody with alphabet soup behind their name, because they're just teaching you what they learned. They might not have learned. You want to learn it. You want to learn it yourself. You know, you want to understand why you're eating the way you're eating. That makes making a menu so much easier. Now, I was just saying, I don't mind being a rebel. You know, I I just I'm always in search for truth. I there was a time where I if I'm presented with new evidence of something, I can change my mind. I you can't You've got to think scientifically. I mean, there was the longest time on my journey where I thought the ketogenic diet was all about, I had to have a certain amount of fat and a certain amount of protein, a certain amount, you know what I mean? And now, over the last, I don't know, 5 or 6 years, I started to understand the importance of protein and that was what I should be focusing on. Just don't fear the fats, but I don't have to, a therapeutic ketogenic diet really, it depends on what you're trying to accomplish. If you're an epileptic, then you want to do the old school 70% fat ketogenic diet because that's what works for them. But when you're just trying to lose weight, I just realized that I could even simplify that, by teaching animal-based protein really makes your life simple, and you don't have to count things, and but you always got to have an open mind, because if I see a new, like, I love reading those studies that change all the time, like new studies out that says coffee is good for you, and then 6 months later a new study came out, coffee's bad for you. I want to read both of those, and I want to understand their angle or whatever, erythritol, good or bad, it changes all the time. Should I eat egg? Should I not eat egg? Of course you should eat egg. But anyway, it's ever changing, and whenever, and you know what, my favorite thing that gets me riled up inevitably, and you watch, this is only October, but in December, all the news organizations do their top 10 lists. Well, somebody on your local news is going to do the top 10 diets. And, the ones that we understand to be the most therapeutic either won't be listed or they'll be listed as the worst. Because every year, keto has become a cuss word for some reason. And because, I don't know, from overuse, or the food industry likes to throw that on a label or whatever. But they always do that, and it's always just makes me laugh, because it'll be some ridiculous outcome, and then but it's presented to people like it's a fact. And that when it comes to science or stuff like that, don't present it like a fact if it's not a fact. It just makes me sad, because there's a lot of people like my own mother, my own brother, that, if they heard it on the news, it must be true. That's the way they think. And, that makes me sad when, you know, harmful misinformation is presented like it's a fact. You know?
Yeah, I agree with you on that. Um, the in my own case, the way I explain it to my patients, low carbohydrate nutrition science exists in a spectrum. So it's like the one, probably in the lowest end of the spectrum would be the, as you said, the ketogenic level of very low carbohydrate, and then probably the carnivore level of almost zero carbohydrate. Because even the carnivores at times get carbohydrates in the form of glycogen, right?
Right.
Like if they eat liver or perhaps some seafoods like oysters, for example. So,
Right.
but the thing is, it exists in a spectrum. So when you say you are doing low carbohydrate kind of eating, it can even be as simple as cutting off all the sugars in your food, like the soft drinks, the the fruit juices.
Oh, yes.
Amazingly, that's funny because fruit juice is branded and marketed as a healthy option, right?
Oh, yes.
So yeah, so it exists in that spectrum, and in my own practice and in my patients, I see already significant improvement, especially in those with metabolic syndrome, for example, or in those who are already morbidly obese, like obese class 2, class 3. Even the mere act of of little by little, for example, stopping Coca-Cola or Pepsi Cola and all that soda, that soft drinks, already does wonders. But then when it's really as I'd say reversal of metabolic syndrome, then I have to tell them you have to slowly go beyond that and really cut off significantly uh, all the other refined carbohydrates in the diet.
Right.
Yeah.
Exactly. And it's so sad that it's just so common, and that the bad foods that are bad for you are so cheap. You know, you go to the grocery store, it's
Uh-huh.
hyper palatable.
So
It is junk food is delicious, and that's the problem. You know what I mean? And it's very psychological to it, aspect to it. It really is, because everybody has their own little personal version of comfort food, and it's usually junk. Usually, you know what I mean? and but if you try and you want to lose weight and you want to reverse your diabetes, you can find a place in your brain and in your emotions to where a delicious ribeye is a comfort food. It's delicious. It really is. It's my comfort food. It didn't used to be. My comfort food used to be pizza, but I haven't had a pizza in, more than a decade. So,
yeah, and pizza would be more addictive,
yes. Oh, yeah.
I
Oh,
suppose.
I was addicted. I was that weirdo that would get a whole pizza and eat the whole thing himself.
Yeah, and amazingly, even if you're eating ribeye steak, for example, yeah, it's one of the more palatable food out there, but it's not really as addictive
Yeah.
as eating
Yeah.
carbohydrates.
Yeah, it's like, doggone it, I'm going to eat this ribeye steak, and I'm probably not going to be hungry for the rest of the day. Oh, no. Oh, no, I've been satiated. What am I going to do?
So, Tim, uh, what advice can you give, let's say, your fellow nutritionists, your fellow dietitians, as well
Never.
as perhaps other health professionals out there who are, let's say, still in the deep in their slumber under the bias, I'd say false propaganda of the mainstream health institutions, perhaps that are that they are painting against the low carbohydrate, healthy fats options in terms of
Well,
uh, dietary and nutrition
if I
choices.
if I had to sum it up, prioritize finding reliable sources, because when you find mentors and that you respect, continue to use them as a reliable source. But bottom line is, never stop learning. Just always, and be discerning about it, because even I can. try to do a deep dive on a topic and then end up reading something that I know is wrong because I don't trust the source. I don't know that it's reliable. I mean, just never stop learning. Don't think just because you graduated with your degree and you got your pretty white coat on that you know everything now. You need to keep learning and you never stop. It's never going to end. You're never going to be just so knowledgeable that you don't need to learn anything because we're always, in the world of science, we're always making new discoveries. And there's new studies and there's new this and new that, new foods, new stimulus in different ways that just most recently in the low carb community there's been a big focus on how your diet affects mental disorders, depression and ADHD. And 5-6 years ago nobody was saying that, but now there's actually evidence of it. There's people reversing, I'm not saying it's
bipolar disorder,
yeah,
not just epilepsy,
yeah,
depression. Yeah.
Exactly. You're never done. Just always be learned and wanting to learn more, because I tell you what, it will pay off. Because even in the early part of my journey, I was rigid in thinking about a lot of things that didn't matter. But as you learn more, you learn how to prioritize things better, and you can be more effective for yourself and more effective towards your, when you're counseling your family or your friends. Just never relent on learning new things. Don't immediately think, oh, that's crazy, I don't believe it. Just look into it, and maybe it is crazy and you shouldn't believe it, but never stop learning. That's the most important thing in my book.
Uh-huh. And you mentioned mental health and low carbohydrate nutrition. I think if I may add to that, among the most notable, let's say, expert sources of that for now would be Dr. Georgia Ede and Dr.
Oh
Chris
yes,
Palmer of
love
Harvard. Yeah, have you heard them?
Diagnosis Diet. I love her.
Diet, yeah.
Yeah, and new book, Brain Energy by Chris Palmer.
Chris
Yes,
Palmer.
I haven't read it yet, but it's on my Christmas list. Santa's going to bring me that book. So, but anyway,
Yeah,
Georgia, I've been following Georgia Eads forever. She's brilliant. I love her.
Yeah, and then the thing is, some colleagues of mine, I heard like, who in the world are they? They're asking me, and then I tell them, you go look them up and you can Google them,
Yep.
So it's like it's not like they're nobody.
Right.
they are trained in Harvard, for God's sake.
Right.
So they know what they're talking about, and they're presenting all those evidence-based data and studies that
Yes.
they themselves have been instrumental in coming up with. So
yeah, it's funny.
It's
funny that you mentioned Georgia Ede, because when I was doing one of my internships before I passed my board exams, my preceptor challenged us all to find a documentation on a study or something that we're passionate about, to share it with essentially the class or whatever. And I can't even remember what the topic was, but it was an article that was written by Georgia Ede in Psychology Today. That magazine that is now it's an iconic publication that's been around since 1967. And the only reason I remember that is because that's the year I was born. but anyway, when I did my presentation and I was reprimanded by my preceptor, he says, I didn't mean for you to read somebody's blog. I'm like, what? this is okay. First of all, Georgia Ede is 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 a is a scientist, and she's a doctor of psychology. And Psychology
Psychiatry.
Today is a publication that's been around longer than you, my friend. So don't you dare call that a blog. Psychology Today is not a blog. And I got furious that I was, you know, he was thinking that I was cherry picking information because I was quoting Dr. Eads, who he's never heard of, but they don't just publish anybody in Psychology Today. I mean, I don't know. That was just one of the many times that I got frustrated with people's closed mindedness. I don't know why I decided to take this topic on that turn, but it just reminded me of a story that was most frustrating.
Is there anything else, Tim, that you might want to state to our audience that I perhaps forgot to ask you? Or probably we covered a lot of things already.
Well, I think we've covered it all. If you're interested in what you've heard from me, I mean, feel free to find my platforms on Facebook, Unlearn-Rethink, as he's mentioned several times, and but the most exciting thing about that is the interactive Facebook group. That's where you can ask questions, get reliable answers, and read about things that I consider to be reliable from reliable sources. And it's a nice way to jumpstart that whole never stop learning and do your own research when you can just expose yourself to different resources and you decide for yourself if you trust them. But I can promise you this, that a lot of them, you can apply them to your life and you can see a difference. So you're all welcome to join me. It's, I don't interact a lot other than that I post in there, and there's a lot of learned, smart people in there that'll answer all your questions. And, it's just a way to get started. You know what I mean? Like your doctor gives you a diagnosis of this, that, and the other. Go learn about it. It's got a search engine feature. Just say, okay, I have high LDL cholesterol, and my doctor wants me to go on a statin. There's a little search button up there. Put in LDL cholesterol, and then just read all the different articles about LDL cholesterol and make yourself more knowledgeable. Because a lot of times your doctor is just going to assume that you don't know nothing. So make yourself knowledgeable about it. It's your health and it's your life, or your husband's, or your wives, or your daughters, or et cetera, et cetera. So just if not my group, there's other ones. I think in England there's a Ketogenic generation. In Australia there's I forget what they're called. But anyway, just never stop learning, and you're welcome to come and share my information from Unlearn-Rethink and ask me questions and whatnot. And something's beeping. All right,
That's
that's
right.
it. That's it.
Yeah. And last thing, then, aside from your Facebook platforms, you have a website that you might want to share to our
Yes,
audience?
I also have unlearnrethink.com with a dash, unlearn-rethink.com, and Unlearn Rethink Interactive. Um, that's right. And there's some exciting announcements that are going to be coming up in the new year. I'm working with a company called Health Quest Global, and they have a website that hasn't gone live yet, but there is you can look at it. Health Quest Global who.int.com, and you can see all the doctors and people that are involved with it. It's gonna be exciting, but we're still getting funding, so we don't know when it's gonna go live. It's kind of
Mm.
an international thing, so it's a huge undertaking, and but exciting for those around the world without um, health insurance. So anyway,
It's exciting indeed.
yes.
So,
So keep your eye
so
out for that, and maybe when it does go live, I'll have some really exciting news to tell you about. One can hope.
yeah. If you're watching, and I'm talking to the audience, if you're watching this podcast now, you can click this link here.
Oh, okay.
This would be Tim's platform, Unlearn-Rethink. Okay.
Well, thank you again.
So, any last words, Tim, to our audience listening right now?
Just thank you for the opportunity, and you'll be seeing a lot of me in the new year, because that's my new thing. I'm going public. I'm bringing it to the world.
Great.
All right. Well, you have a wonderful day, sir, and I've enjoyed this very
You
much.
too. Okay. Thank you very much, Tim, for your time, and see you around again
You know it. Keep
next
in touch.
time.